안녕하세요.
안녕하세요.
와, 선생님 진짜 그대로신데요?
와, 똑같아요.
감사합니다. 제가 좀 예뻐졌죠?
한국말이 힘들어요.
예쁘다는 걸 참 싫어하시는 것 같습니다. 예. 자, 오늘 아놀롭스키 선생님을 모시고 이제 심장에 대한 얘기를 할 건데요. 선생님 일단 어떤 분이신지, 선생님의 어린 시절은 어땠는지 좀 궁금한데요.
I was born in Morris County, New Jersey.
뉴저지
I grew up in New Jersey, and I went to school in Philadelphia for 8 years, where I first became interested in heart surgery in college and medical school, and then went to New York City, where I did my formal training in general surgery and cardiothoracic surgery.
네. 근데 왜 의사가 됐는지 정말 궁금해요.
I actually became a doctor because I was most interested in heart surgery. When I was in college, I was looking to make a few extra dollars, and there was a job opening in a cardiothoracic surgery research lab where they were doing experimental heart surgery on sheep. When I showed up the first day, they told me they had no money, but if I wanted to stay and watch, I could help out with these operations. And I fell in love with it. I saw a sheep's beating heart, and we were doing surgery on it, and that was it. I was hooked.
그게 바로 이제 심장 닥터가 되신 동기가 된 거군요. 그러니까 돈이 먼저, 그다음에 이제 심장을 사랑하신 것 같은데요. 근데 이제 우리 몸 안에 많은 장기 중에서 뭐 여러 가지가 있잖아요. 근데 어떤 게 더 중요한 것 같으세요? 그 머리인 것 같으세요? 아니면은 심장인 것 같으세요?
It's funny. Every doctor you ask what the most important organ is, they'll answer that the organ that they work on is the most important.
네.
So if you ask an ear, nose, and throat doctor, they'll tell you the purpose of the heart is to pump blood to the ear, nose, and throat area. So I think the heart is the most important, obviously, but I'm very biased.
조금 더 구체적으로 얘기해 주신다면요.
You know, the heart is the main pump that circulates our blood throughout the body. So without it, nothing can do its job. The heart pumps the blood and the nutrients everywhere it's supposed to be. So the liver, the kidneys, the brain, nothing can work without the blood pumping through it. So it's important to have a good, healthy, strong heart.
언제 제일 마지막으로 이렇게 가슴 뛰는 일이 있었어요?
Performing heart surgery makes my heart race. Just this morning, I operated on a gentleman who had multiple blockages of the arteries, and you know, it's a little bit stressful, but it's very important to do a good job so that this guy can enjoy many years of good health after the surgery. So when we're doing the operation itself, it's a real rush. You know, my heart's racing with excitement, with nerves, with anxiety, and with the attention to the procedure.
지금 아내를 만났을 때 그때는 심장이 어떻게 뛰었어요?
So that's a great story. We met at work, actually. My wife's a nurse, and obviously I'm a doctor. I was in training, and we met. She tells the story better than I do. She was a pretty new nurse who was asked to go to a new area of the hospital, and she was taking care of a patient I was looking after, and the patient was an old woman, put a chest tube in, which is a little a tube inserted between the ribs. So I needed her to help hold the woman's breasts out of the way while I did the procedure. And while we were doing the procedure, I asked her out for a date. And so we met over this, while she was holding this woman's bosoms out of the way for me.
근데 그때 심장이 진짜 막 이렇게 쿵쾅쿵쾅 뛰었어요?
Yeah. I knew when we met that she was the girl for me. To keep your heart strong and healthy, the most important things are diet, regular exercise, and good sleep. So diet, I would say to avoid fried foods, avoid fatty foods, and have low sodium, low salt. Exercise, cardiovascular exercise, such as walking, exercise bike, treadmill, 30 minutes a couple times a week is very good. And the right amount of sleep.
심장 스크린하는 게 얼마나 중요한 건가요?
So screening, the most important thing is to talk to your doctor about how you're feeling. The doctor will take an appropriate history and physical and see if there's any risk factors that can be identified. The risk factors for heart disease are smoking, diabetes, high blood pressure, high cholesterol, family history. After that, doctor listening to your heart is probably the next step. An electrocardiogram is the next step after that. And if something comes up abnormal, there's further testing that can be done, such as stress testing, either with exercise or without exercise. And then the sky's the limit from there if anything's found.
심장 박동수를 알려주는 스마트워치가 정말 도움이 될까요?
I know one of the cardiologists has a story that his patient has a smartwatch, and the watch kept telling him that his heart rate's too fast. And sure enough, he went to the doctor and says, you know, my watch keeps giving me these alerts. And sure enough, he had an abnormal heart rhythm called atrial fibrillation, which is an abnormally fast or irregular heartbeat. So the watch can actually help in diagnosis and tell if something is wrong or not.
네요. 우리나라 말에 중이 자기 머리 못 깎는다는 말이 있거든요. 네, 저 심장 닥터신데 진짜 심장 스크린 그렇게 정기적으로 하세요?
Doctors are the worst patients. So I have all my fried food, all my salt, no exercise, and I don't get enough sleep. I try my best, but I feel very guilty that I fall short of my own advice. Oh, Misan, I have something for you. I forgot in my pocket.
뭘까요? 아.
Seminare so, beo.